Tonight, as we continue to remember the tragedy at Virginia Tech, we put mental health back under the microscope.
Lawmakers responded to the mass shooting in 2007 with a $42 million legislative package to reform the state's mental health system. 10 on your side, Stephanie Harris looks at changes made and where we still might fall short, Steph.
Well, Anita, Chris, 23-year-old Sung Wee Cho, a deeply disturbed and dangerous man, never received the mental health treatment that a judge ordered him to get. He slipped through the gaping holes in the system. Holes lawmakers determined to fill the very next year, passing 24 new laws. But we found parents still struggling today to find treatment for children with mental illness.
I don't know what's going to happen.
Like a mama bear, Jessica Eason has been clawing her way through the mental health care system for 12 years.
And here we are. I mean, I can't say that we've had positive results.
Her 17-year-old son's struggle began shortly after the tragedy at Virginia Tech, after lawmakers enacted sweeping reforms.
We really feel that overall it's been positive. That doesn't mean that there still aren't problems and things that need to be addressed.
Mira Signer is executive director at Virginia NAMI, the National Alliance on Mental Illness. She applauds lawmakers on changes that brought accountability to the process for mandatory outpatient treatment, clarified the criteria for involuntary commitment, and increased state funding for community mental health services. But would these reforms, had they been in place, have prevented the school massacre?
That's the $64,000 question.
Are these reforms protecting Jessica's son, who's been committed twice, in and out of group homes, and now sits in a juvenile detention center?
People will judge you, and they will think that you're just not a good parent, that you're not disciplining your child, you're not paying them enough attention, where it has nothing to do with any of that. I've fought so hard.
Despite reforms since the Virginia Tech shootings, the Commonwealth has witnessed the tragic results of system failures. In 2013, Senator Creed Deed's son Gus stabbed his father and killed himself after a commitment order expired before a caseworker could find a hospital bed. And 2 years ago, Jamichael Mitchell died of starvation in the Hampton Roads Regional Jail when paperwork ordering his transfer to a mental hospital slipped through the cracks.
It's an inherently complicated, complex system with lots of room for error.
More new laws have gone on the books since both of those tragedies. Still, Eason contends families don't need more legislation, they need more doctors. This map shows the shortage of psychiatrists in Virginia. Look at all the areas shaded in blue. It's about 3/4 of the state. It can take 2 months to get an appointment, and that is an eternity for someone with impulsive behavior.
He just doesn't think because he sees red when he gets upset, which is very easy for him to get upset.
And that's upsetting for her and so many others who continue to fight stigma, loopholes in the law, and a lack of mental health care.
But we still believe, we still know that he has a future, and we need him to have a positive future.
And another hurdle I hear families and schools, social workers talk about they still face is HIPAA, the federal privacy law. And while states cannot change that, experts say you can work within its parameters. It does not prevent anyone from sharing concerns and experiences with a patient's healthcare provider. Stephanie Harris, 10 on your side.